What I wanted to talk about today and is the role of states in this process. And I want to start with the foundation that basically what happened is the feds have this idea of what they want health information technology to look like at the distant future, 5 years from now or thereabouts. And they want to get there, but they're not quite sure how they want to do it. They know what the standards are. They know what interoperability is. They know what their role is to come up with money and to come up with standards. But they don't have access to the lowest level of where it actually happens. And a lesson that we learned probably 5 or 8 years ago with the Health Information Privacy and Security Collaboration, which was a group of 40 or so states, including New York, the lesson was that healthcare implementation is, for a large measure, local in nature. If you don't get the mom and pop doctors and the small practices to hook up with the local hospital, and then the local hospitals to hook up amongst themselves to form a regional entity, and then hook up to a larger entity, you're not going to have anything. So when the stimulus money came available through high-tech, they basically turned to us in the States and said, all right, now, here's what we want, and this is what it has to look like, but you have to work out a solution that works in your own individual state. And this is not something new to them. They did this with that HISPIC project I told you about. They had turned to us 5 years ago and said in the States, you do a baseline study of what the law is in New Jersey or Ohio or wherever. You do that study. You figure out what the barriers are legally and business practice-wise. And once you know what those barriers are, then you work out solutions. And we'll tell you if we like them or not. Of course, that puts all the burden of coming up with creative solutions on the states and people like you and me.